this video, we are going to talk about, is your cardiologist responsible for dementia? So dementia is a condition where there is impairment in your ability to remember things, think clearly, and perform tasks that interferes with your day-to-day activities. The strongest risk factor for dementia is age, and then we have familial history or genes. But not many of us are willing to explore this reason, that is doctor-induced dementia. So one of the favorite drugs of your cardiologist is statin. If 10 people go to visit a cardiologist, 8 will be given a statin supplement because most of the cardiologists are obsessed with this drug. But in my humble opinion, this drug does more harm than actual benefit for your body. Now, statin is known to cause inhibition of K2 absorption, and it decreases K2 inside your body. Now, K2 is very important because it inhibits vascular calcification. That means it prevents calcium deposit inside your blood vessels, because K2 is needed to activate a protein, that is matrix GLA protein. So that protein inhibits vascular calcification as well as soft tissue calcification. So in absence or deficiency of vitamin K2, your matrix GLA protein won't be activated and it won't do its job, which is inhibiting vascular calcification. And vascular calcification will lead to arterial stiffness. And arterial stiffness is directly proportional to dementia. As we age, our arteries get stiff, and as arteries get stiff, we have dementia. So the only modifiable factor is K2. Out of age, out of genes, and K2, the only thing that we have control is increasing the amount of K2 inside our body to prevent arterial stiffness. And what your cardiologist do is actually worsen your stiffness and increase the chance of dementia. Now, vitamin K2 is also very important to inhibit neuroinflammation, as well as it's very important to enhance mitochondrial function. And neuroinflammation, that is inflammation of your brain, and decreased generation of ATP by mitochondria can actually lead to dementia, because your mitochondria generates ATP. And if your body does not have enough ATP, it can worsen your cognitive function. And your cardiologist is actually causing decrease in K2 and increasing your risk of dementia. Now, vitamin K as a whole, both K1 and K2, they control neuroinflammation and they possess antioxidant activity because they are involved in controlling certain pathways in which certain proteins take part, like NLRP3, caspase 1, NRF2. So they actually modulate the activity of this protein, and that leads to an anti-inflammatory as well as enhanced antioxidant activity. So both K1 and K2 are necessary, but K2 is very much necessary to prevent arterial stiffness, and arterial stiffness is directly proportional to dementia. So that is why I tell people, rather than following a vegan or carnivore diet, it's very important to follow a healthy, balanced omnivore diet. And one of the best examples is Mediterranean lifestyle, because the primary source of vitamin K1 is leafy vegetables, and mainly we get K2 from non-vegetarian foods. Of course, you can get through certain fermented foods also, but the thing here is that if you eat a balanced, well-balanced diet comprising of animal protein, comprising of vegetables, the chances of you suffering from any deficiency is very less. Of course, at the end of the day, it's about healthy choices also and avoiding pro-inflammatory foods also. Now, vitamin K is also very important because it promotes the expression of tyrosine. Tyrosine is an amino acid that is concerned with cognitive function. That's very good for your brain. But eating just tyrosine-rich food is not enough for your brain. Just like having enough money in your bank is not enough. You need certain mediums to draw that money, like ATM, check. So you need certain medium through which you can draw money. and use it for your expenses. So similarly, just eating tyrosine rich food is not enough. To enable it for your brain function, you need vitamin K. So K acts as ATM by which you can utilize this tyrosine, which is your money, for your cognitive function, which is your expenses. So it's very important to improve your brain health. Tyrosine plus vitamin K. So that is why I always tell people to eat both plant and animal products. That's the best thing for your body in the long term. Then there's also one thing, that is dysbiosis is directly proportional to Alzheimer, which is the commonest form of dementia. Now, dysbiosis means your digestive system is unhealthy. And if you have digestive issues, and if you are old age, and if you have a familial risk, then the chances of having dementia is very high. So again, the only controlling factor here is, the only thing which you can control here is improving your gut health. So you must try to improve your digestive tract, your gut health. And also, if you have dysbiosis, what it does is that there is decreased conversion of vitamin K1 to vitamin K2. Remember that some amount of vitamin K2 is also generated in your digestive tract, in your gut, by K1 to K2 conversion. So if your digestive tract is unhealthy, there will be less amount of K2 generation, and that will lead to increased chance of having dementia, because it will cause vascular calcification. So improving your digestive health is also very, very crucial for staying away from Alzheimer. And besides taking supplement, which is MK7 version of vitamin K2. Then some doctors also are fond of metformin, but they do not discuss vitamin B12. So metformin blocks the absorption of vitamin B12, and a long-standing uncorrected case of vitamin B12 can ultimately lead to dementia. So if you are on any of these two drugs, that is statin, metformin, ask them about K2 and B12. This is very, very important, because if you do not ask them about these two things, there is high chance of you suffering from side effect.